Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Ondo. No fewer than 1,106 cases of tuberculosis diseases have been detected across the 18 local government area in Ondo State between January and June 2021. This was disclosed by the State Coordinator of the National Tuberculosis, Buruli and Leprosy Control Program, Dr. Oluwafemi Aino, who said the agency had been embarking on a series of campaigns across the country to curb the disease just as the country is battling with the spread of COVID-19. He said the cases detected in the state were reported on a quarterly basis, explaining that from January to March, 635 cases were recorded, while from April to June, a total of 471 cases were reported. And a recent study compared the likelihood of children of different age groups transmitting SARS-CoV-2 to household members. The study reported that children under 4 years were more likely to transmit the virus to their parents and siblings than adolescents aged 14 to 17 years. Testing delays on larger household size were associated with an increased risk of children transmitting SARS-CoV-2 to family members. These findings may inform the behavior of household members and public policy decisions related to schools or childcare. And Dr. Kamal Vig, a professor of biology in Alabama State University's Department of Biological Sciences, has been awarded a National Science Foundation grant to research and offer effective, cost-efficient solutions for the treatment of cardiovascular disease. Utilizing tissue engineering, Vig received a total of $95,340,000 grant out of a total grant of $1.5 million that is shared with Alabama State University, Stanford University, and Urban. Vig is a co-investigator on this project that is funded through to 2025. According to her, one of the goals of this grant is to prepare undergraduates for a successful transition into STEM graduate programs and the STEM workforce. Students involved in the project will conduct research in collaboration with Urban University and Stanford University in California. Alabama State University students will have opportunities to participate in various collaborative activities, as well as present their research in national and international meetings. Also, a study has shown that gum disease is associated with an increased risk of cardiovascular disease. It states that the more severe the periodontitis, the higher the risk. According to the study's author, Dr. L.G.A of the Karolinska Institute, Stockholm, Sweden, the study suggests that dental screening programs, including regular checkups and education on proper dental hygiene, may help to prevent first and subsequent heart events. The Swedish rank study previously showed that periodontitis was significantly more common in first-time heart attack patients compared to their healthy peers of the same age and sex living in the same area. And British scientists have developed a new malaria vaccine that has produced striking trial results and could save the lives of millions of young people in Africa. The study, which was carried out alongside researchers in Burkina Faso and Mali, showed that given young children the world's first malaria vaccine and anti-malaria drugs cut deaths from the disease by 72.9%. Scientists from the London School of Hygiene and Tropical Medicine said their results are striking and surpassed expectations. Their work, published in the New England Journal of Medicine, followed some 6,000 children aged between 5 months and 17 months in the 2 West African countries, both of which have a high burden of malaria. This is TOS Television Network, and you're watching Health 54. Do stay tuned. Welcome back. This is Health 54 on TOS Television Network. Kogi State government on Wednesday confirmed that 129 cases of cholera and 8 deaths were recorded in 5 local government areas of the state. In a statement in L.G.A, the State Ministry of Health said the cholera outbreak was recorded in Kogi, Bassa, L.G.A, Ankpa and Kababunu council areas. Dr. Austin Ojotu, the state epidemiologist who signed the statement, said the cholera cases were recorded between February and August. No fewer than 354 Lassa fever deaths have been confirmed in Nigeria since the beginning of 2021. This is relatively lower than the 220 people that had died at this time of the year in 2020, when 1,060 cases had been recorded. 2021 so far, 14 states out of 36 states have recorded at least one confirmed case across 60 local government areas in the West African country. Of all confirmed cases, 83% are from the states of Ondo, Ondo, and Taraba states. The predominant age group affected is 21 to 30 years, with the male-to-female ratio for confirmed cases at 1:0. Lassa fever is a viral infection carried by the multi-mammate rat, one of the most common rodents in Equatorial Africa. And Japan has stopped the use of over 1.63 million doses of the Moderna's COVID-19 vaccine after reports of contamination in several vials. Takeda, which is in charge of sales and distribution of the Moderna shot in Japan, said it had received reports from several vaccination centers that foreign substances have been found inside unopened vials. The firm said it had informed Moderna and requested an urgent investigation. Moderna did not immediately respond to a request for comment. Takeda did not detail the nature of the contamination, but said it had not so far received any reports of health concerns arising from affected doses. According to details shared on Thursday night by the Nigeria Center for Disease Control and CDC on its official Facebook page, Nigeria registered 10 additional deaths within the last 24 hours. Noted that the new infections were reported across 19 states of the Federation and the Federal Capital Territory. The data indicates that the new cases increased Nigeria's total infections to 189,715, while the fatality toll rose to 2,298 from 2,288 reported 24 hours earlier. The agency also noted that the country had successfully treated and discharged 169,626 COVID-19 cases, although 17,791 are still down with the illness. That is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.